Hi, everybody. Dr. Botha from Mooi Medical Spa. I'm a board-certified OBGYN practicing in wellness and aesthetic medicine.
Hi, my name is Cian. I work with Dr. Botha. I'm working with Dr. Botha for over 10 years and loving every minute of it.
And our job now is to help bring information to the community. I've taken it upon myself and Cian as well in bringing other providers in and teaching them so that they can bring this wonderful medicine of hormone therapy, because we're not trained in it in traditional medicine. One of the things Deanne loves to hear about, and one of my favorite topics, is
Progesterone.
Progesterone. So talk about estrogen, and remember when I said estrogen is a fertilizer and progesterone is a lawnmower. So balance is essential. There's women at a very young age that do not have enough progesterone. These are the women who are more androgen dominant, PCOS. Honestly, in my patient population, chronic pain patients with endometriosis had very low progesterone. And that's part of what I did, was replenish that. So all women in every phase need it, especially estrogen dominant, perimenopause, and menopause.
So with the progesterone, I know there's kind of different ways, topical, things like that, but there's no really one size fits all with that. So what are you?
Absolutely. So for a lot of women, progesterone is a scary hormone. Women who have PMS, right? 2 weeks prior to your period, you have higher progesterone. Those women do better on a different form, the form that bypasses the liver, because when it goes through the liver, it gets broken down into a metabolite that causes PMDD symptoms. So those are women where sublingual, rapid dissolve tablets, troche, or intravaginal is going to be best. And that actually gives the best level reached, right? So topical, not so much. If you put progesterone on the skin, it's a big molecule, you're not going to get great levels, because remember, progesterone is found in many different organs. It's found in our brain, our skin, our breast tissue, our reproductive organs, so like our vaginal tissue. It's found in our bones. And so it's not just our uterus we want to protect. Yes, it helps with heavy bleeding, but it helps with so many other things, which we're going to talk about next. So if you're going to do topical, don't have that as the protection part of the progesterone. And we really need to check labs. Levels are important. You need a good quality progesterone, and you need to be very specific levels for protection. And I think the next question is going to be,
I was
right?
gonna say, speaking of protection, what kind of things does the progesterone protect?
So progesterone downregulates estrogen. It helps modulate estrogen. So it's very protective, but it also, like I said, it balances it out. So we talked about it's in the breast, it's in the brain, it's in the pineal gland, it's in the central nervous system, it's in the vaginal tissue, it's in the bone. And so all those areas, it helps modulate with estrogen for protection. So it's a great mood stabilizer, right? So you take it and you just feel so happy. Nothing bothers me when I take progesterone. Helps you sleep. So you need progesterone in order to have good hormone balance.
So you talk about progesterone being protective from like cancers and things like that. Let's dive into that.
Absolutely. Yeah. So progesterone along with testosterone is what we call oncoprotective. So it helps stimulate a gene called the P53 gene, which helps destroy cells that are not supposed to continue to survive. Apoptosis, which is really what helps modulate and regulate our normal cellular function. Without that, we have cancer. So we have progesterone and testosterone there when we're younger. In perimenopause, you stop ovulating. And so you have high estrogen, which, remember, we talked about insulin resistance. So progesterone comes along and helps modulate that. So very protective. Breast gets stimulated by estrogen. Progesterone helps protect from fibrocystic breast disease. So for women who have a lot of fibrocystic breast disease, they should be on progesterone, especially women who've had hysterectomies. You have very high estrogen because you had heavy bleeding. That's why you did it. Well, let's talk about our breast tissue.
Yes, ladies, protect the breast at all costs.
Right.
So we talked about progesterone that being oncoprotective, breast protective, things like that. What does it do for the vagina?
So, progesterone helps regulate an enzyme called nitrous oxide synthetase, which helps cause congestion. So when we have arousal in females, it brings a lot of blood supply to our vaginal tissues, and it helps improve arousal, sexual function. It stimulates GABA receptors, which are the happy hormones. So it helps you feel good, and it helps you want to have more sexual relations. So it really helps in the intimacy department. So testosterone, estrogen, progesterone, all are on board together, and they all got to work together. They all have to work together. Little slang there.
So I know progesterone helps with symptoms and things like that with perimenopause and menopause. I know
Absolutely.
me personally, I suffer from migraines, and I know that that's one of the things it kind of helps with. And I think there's probably plenty more.
Absolutely. So remember we talked about how perimenopause is estrogen dominant, and women who've had hysterectomies think they're in menopause, but they have really high estrogen. So those symptoms are a lack of progesterone. When you have bloating, anxiety, weight gain, mood instability, hot flashes, all of that is low progesterone. So when we bring that in the system, all those symptoms go away. And what we do here at Mooi is teach you how to understand your symptoms and adjust your progesterone month to month, because every month's different in perimenopause, right? And so, in summary, progesterone helps with improvement of mood. It helps improve bone density. It helps improve your skin health. That's why hormones are so tied in to what we do, right? It improves collagen and it improves skin elasticity. So you girls out there, you need to get on your progesterone.
Let's talk
It will
about
change your lives. Come on in and see us.
Let's talk about it. I love it.
If you want to hear more, like and subscribe, and we will be posting more content to educate you more. Dr. Tracey Botha from Mooi Med Spa, where I want to educate everybody on hormone therapy so you can be your own advocate. Stay tuned.